Good morning everybody, Keith here with Balanced Body and Mind. Today I want to talk about understanding hip flexor function and why people often make the mistake of stretching out hip flexors without fully knowing what's actually going on. There's a very well respected physical therapist called Yanda, and he proposed a syndrome called the lower cross syndrome. Now with the lower cross syndrome, what tends to happen is the ilium, or the bone of the hip, tends to migrate forwards, causing an anterior tilt. Now what is usually suspected of this is that the hip flexors are causing the anterior tilt, maybe combined with strength in the erector spinae, possible weakness of the lower abdominals, and also possible weakness of the glutes and the hamstrings. The problem is that many people tend to assume that this anterior rotation is caused by hip flexors. The problem is that unless you actually assess the hip flexors, you have very little idea of what's going on. So we can use a Thomas test. And a Thomas test gives us a small amount of information, but a lot of people tend to make the decision to stretch the hip flexors, which is composed of the iliacus, the psoas, and also the rec fem, which also extends the knee joint as well. And then go on and make a decision whether to stretch those. But it gives us very little information to go on. So here we're going to have a look at a Thomas test, and then we're going to make some assumptions based upon the Thomas test, and hopefully give you an idea of when to stretch the hip flexors or when not to. Typical test that we can do is the Thomas test. I'm going to use Ben here to assess his Thomas test, which is a standard test for assessing hip flexor, lateral chain and rec fem all in one go. Just lift one knee up towards your chest and hold with both hands. Just going to pop you back. Good, just relax there. And just pull that in a bit more. Okay, from here what we're looking at is whether to see if there's any psoas activation here. And his psoas isn't too bad. There's not much that suggests his psoas is implicated. There's a little bit of spring there, and I want to investigate that. With the rec fem, it suggested that it should be able to flex down to about 80 degrees. However, what this tells us is not what we need to know. What we need to understand is just because a muscle might be short, it might not be short and tight. It might be short and weak. Hence with the psoas here, it's a little bit springy and it goes down to its normal position, but it doesn't actually tell us if this psoas is overworking or not. It doesn't tell us whether there's any lengthening and tightness or lengthening and weakness, so we need to investigate this further before we assume, say if his leg was up here, we might assume psoas is overworking and he needs to stretch his psoas out. A length tension test is what's needed to actually confirm what's going on. So whilst the Thomas test gives us a look at what's going on at the joint and the muscles that are working, it's not definitively going to tell us whether we need to stretch or strengthen this. This is where philosophies such as NKT come in and help to differentiate what's going on. What a lot of people might do based upon this is go and stretch out the rec fem because it might appear to be in a shortened state, but it might actually be weak, and this is where we need to test the rec fem before we go stretching it. So, you saw the Thomas test, and from the Thomas test what you can tend to see is that maybe a muscle might be in a shortened position, it might be in a lengthened position, but it doesn't actually tell you whether you're in a weakened state or a strengthened state, and that's where individual muscle testing will come in. The problem with this anterior tilt, and there are many things that could be causing that, and we talked about some of those issues earlier on. Things to look for, particularly with the anterior tilt, is making the distinction between the psoas, which is the muscle that connects to the lumbar vertebra and then onto the thigh bone, and then the iliacus, which comes more from the iliac crest and down into the thigh bone, which both cause this anterior rotation, and then the rec fem. More often than not, I often find that the rec fem doesn't need stretching too much because it's not working. Usually you can tend to find, say, the calf muscle compensating for possibly the hip flexors, the rec fem, even the glute. A good sign that your calf is overworking is it's constantly getting tight, but despite how many stretches that you do for it, it tends to stay tight. So find someone that can make a distinction to which hip flexors are actually working, which ones aren't, and maybe look at the interaction between the calf overworking, say in compensation for the rec fem or the other hip flexors. That way you're going to stay uninjured for a long period of time, and also you'll actually get to know why you actually get the compensation occurring in the first place. So if you get calves that are constantly overworking, constantly tight, and not getting any resolve through your stretching or your massage, get someone such as a neurokinetic therapist who understands the link between, say, the calves and the hip flexors not working.